We believe public health should be prioritized by the government and that liberal societies need to pass legislations that will improve the health of citizens. By creating mandatory vaccinations and extensive health regulations for products, we can ensure the prevention of disease, prolonging of life, promotion of health, and prevention of disease. However, by creating these rules and regulations, a liberal society will be choosing to put the health and well-being of their state before civil rights and freedoms. This can become a problem in situations where it's against a religion to be vaccinated, such as Jehovah's Witnesses. We feel that this could be an exception to our rights and freedoms to help secure the health and the security of our nation. Without these extra precautions, nations are at risk of extreme pandemics that could ultimately lead to world catastrophe.
Since tobacco was first discovered, it has been subject to regulatory controls over the quantity and quality of production. Through trade with European colonists, tobacco assumed a central place in the beliefs of First Nations, both as a gift to be offered to the spirit world and as a means of communication between humans and spirits. Of course, the concepts of addiction and drug-seeking behavior and negative health side effects were unknown at this time. Today, through extensive research and studies, we now truly know the dangerous side effects of cigarettes and nicotine. Restrictions have been fostered in an effort to suppress addictions, especially amongst youth. For example, the Tobacco Act was passed in Canada in 1997 with the goal of protecting citizens from the harmful effects of tobacco products by imposing restrictions and limits on the production and sales of tobacco. Key regulations include all products must be manufactured up to product standards, information must be provided about the health hazards and emissions, and tobacco products may not be sold to a person underage. However, tobacco products have been a substantial source of revenue towards the state and the government. By increasing the price of tobacco products, it encourages people to quit tobacco while discouraging young people and increasing government revenues. This saves countless lives each year and reduces healthcare costs. Today, the world has adapted a quicker response to global pandemics that integrates prevention and control of both communicable diseases and non-communicable diseases within a comprehensive healthcare system. However, antibiotic-resistant infections are emerging in global healthcare. The global spread of microbial resistance is the main reason why infectious diseases have not been conquered. Pathogens are the most numerous, diverse, and adaptable organisms on the planet, and as new antibiotics develop to fight the bugs, new strains appear. In liberal democracies, disease can have intense social and political consequences. It affects not only the country, but the economy as well. The government is held accountable in the steps they take to solve the crisis. Liberal societies are faced with critical questions such as, should vaccines become mandatory during times of crisis? Should citizens be forced into quarantine? Disease can affect a country's prestige as well as hinders development and growth.
In 2003, there was a SARS outbreak in Canada. SARS stands for Severe Acute Respiratory Syndrome. SARS is an unusual pneumonia-like condition. A Canadian contracted the syndrome while visiting Hong Kong. When she returned back to Toronto, she infected her son, and they then both unknowingly infected others around them. Throughout all of Canada, there were 44 deaths, 400 illnesses, and 2,500 people affected. 85% of the residents affected in Canada resided in Ontario. SARS was viewed as a mystery bug because doctors were unprepared on how to treat it, which leads to the three things Canada learned from SARS. Number one is knowledge is power. Doctors didn't know enough about it to treat it or diagnose it. Two, they have protocols for frontline workers, like controversies over protective wear for healthcare workers. Now there are more preventative measures and control procedures to identify and manage potential outbreaks. They screen travel history and past procedures to protect the citizens of Canada. Third is clear timely communication. It is key, and that is why they've created World Health Organization when dealing with international study and detective possible spreadable pandemics. The Public Agency of Canada takes steps to make Canada less vulnerable to infectious diseases. They rapidly detect and protect Canadians. They work in the background unless there's an outbreak like SARS.
The focus of public health intervention to improve the health and quality of life through prevention and treatment of disease. This is done by government through the surveillance of cases and health indicators, promoting healthy behaviors and awareness to citizens. Examples of common public health measures include promotion of hand washing, breastfeeding, and delivery of vaccinations. Within our liberal society, public and private healthcare are convenient and available to all citizens. Most liberal societies are also connected to WHO, the World Health Organization. The World Health Organization provides leadership on matters critical to health and partnerships where joint action is needed. Starting and creating a research agenda and transition to available knowledge is also a main priority for them. They also monitor health situations and health trends. They serve as an early warning system for impending public health emergencies. They diagnose, investigate, and monitor health problems and health hazards for the community. These public surveillance has led to the identification and prioritization of many public health issues, such as Ebola, AIDS, H1N1. We feel that all of these actions taken by the government are justified because it promotes both health and stability of the nation. They've also done this without compromising any major rights and freedoms of citizens.
Since March 2014, over 3,000 people have died from the relentless spread of the Ebola virus throughout the West African countries of Guinea, Sierra Leone, Liberia, and Nigeria. Despite the heroic efforts of the humanitarian and medical professionals in these countries, crumbling public health systems, which were notoriously weak even before the current outbreak began, and a lack of facilities, equipment, and medical staff have tragically not been able to stem the tide in these countries. Distrust of the government, fueled by decades of civil war, has also prompted attacks on health workers by fearful groups, further undercutting crucial outreach and educational interventions aimed at sensitizing communities to the virus and breaking the chain of transmission.
Consumers worldwide are plagued with the new H1N1 influenza, according to the World Health Organization. The H1N1 influenza, also known as swine flu, has a higher rate of infection and has caused the flu season to begin earlier than prior years. Fearful consumers race to understand how to protect themselves online and also purchase preventative products. The increased rates of infection have caused spikes and declines in selected categories.